Yeah.
Namaskar. Warm greetings to our Fogsi President, Dr. Sunita Tandulwadkar, and our distinguished guest, Dr. Sheila Mane. A very good evening to all our listeners tuning in to Gyan Pravah, the podcast series. We are delighted to have you join us from across the world and around India. Wishing you a very happy and prosperous New Year 2026. Welcome to episode 339, brought to you by the Clinical Research Committee of Fogsi under the dynamic leadership of Dr. Sunita Tandulwadkar, President of Fogsi 2025. I am Professor Dr. Surekha Taire, Chairperson of the Clinical Research Committee and your host for this evening. Today, it is my privilege to welcome Dr. Sheila Mane, the chairperson-elect of the Indian College of Obstetricians and Gynecologists, and we will be discussing the ICOG Vision 2026. It is truly my distinct pleasure and deep honor to welcome a leader who needs no introduction, yet deserves every word of appreciation we can offer. Our very own president of Fogsi, Dr. Sunita Tandulwadkar. Dr. Sunita is someone where vision does not remain on paper. It moves, it builds, it transforms. Behind her remarkable achievement lies years of relentless hard work, razor-sharp focus, and an extraordinary ability to think ahead of her time. Her journey reflects not just clinical brilliance, but exceptional business acumen and organizational leadership, qualities that have elevated institutions, teams, and people around her. We are all privy to the enormous work she has done as Fogsi President 2025. Na bhuto, na bhavishyati. She has raised the benchmark very high through her high-quality, women-centered projects and initiatives. An acclaimed IVF specialist, endoscopic surgeon, researcher, author, academician, she has a keen eye for detail and a deep respect for evidence and research. Yet, what truly sets her apart is her mentorship, the way she handholds, nurtures talents, and uplifts others, ensuring that many rise along with her. Her words ignite belief, especially among young doctors who see in her a role model who proves that excellence and empathy can walk hand in hand. Please join me in welcoming a woman who continues to pioneer progress, empower lives, and inspire generations. Over to you, ma'am.
Thank you, Surekha. I don't allow anyone to talk about me so much. And Surekha, the way you articulate the work, I don't want to get elated. अहंकार आता है जब आप बहुत स्तुति सुनते हो. बट आई ऑलवेज फेल्ट कि सुरेखा को बोलूंगी सब इंट्रोडक्शंस जो मेरे किए हैं ना वो मुझे भेज दे. हर इसमें शी स्पीक्स डिफरेंटली विद द सेम मीनिंग. एनी टाइम आई विल गो थ्रू द लो फेज इन माई लाइफ. होता ही है सबको, कभी कभी लो फेज आता है, लगता है आज बहुत लो फेज लगता है शाम को, तो आई रीड अबाउट माई सेल्फ एंड आई विल फील अगेन बैक हैप्पी. So with the God's grace, such moments don't come often, but we have crossed that perimenopausal age also. So at 62, you don't get that any phases. But it's lovely to hear about whether true or false. But most importantly is let's talk about our faculty, Dr. Sheila Mane. Welcome to the Foxy platform. I know you yourself are the big Foxy organization leaders. You are taking over as ICOG chairperson. So it is a little difficult way to say welcome on a Foxy platform. But our Gyan Pravah platform is one of the most important platform to be on. We have chosen 339, but we are going to complete 351 episodes. We have chosen very minutely the leaders to whom we should be interviewing. They may not be academic, they may be from social, philosophical, uh, philanthropic, any background, who is doing amazing work globally, whether from India or outside. And believe me, Sheila, when I curated this, I never knew how it is going to go. I said my chairperson need to have a 1 hour of platform where they can show their talent, they can speak, they can interview the leader of their choice. They are the ones who are selecting. I never interfere so minutely in all, because then you never grow in organization if you don't believe your team members. They always, and when one podcast get over, the another podcast they start thinking about whom shall I take, what shall be discussing, and they evolve themselves. I felt, Surekha, today your voice was like a AI generated voice. You can give your voice for a AI generation, and you will be minting money.
Thank you, ma'am. Whatever
I
I spoke, it was from the heart, ma'am.
I know that. And Sheila, this program is successful only because of my chairpersons. Everyone is fantastic, but Sureka has one quality, and that's why she was included in many academic project, I must say, is dependability. You can be dependable on her. You give her and the task will be done. My one program she is doing, which is UNICEF, connecting with the 50 medical colleges. And Ashwini said UNICEF wants to do this project with us. It's not a huge money, but it's a very beautiful project of connecting with the 50 medical college HODs and all. Whom should you be involved? Whom you want to be making convener position? I said Surekha Tade. That's it. I don't even ask me anything. Just give her a ring and do that. And the way she took this program, it's ongoing, but it's not only conducting the program, not only connecting people, but implementing the program, ensuring the audit report, financial audit report, and clinical auditing.
Yes.
Everything. I don't have to do anything. I just move on to the next project. And I involved myself in getting another project from UNFPA. I involved myself getting in CF. And I'm giving everyone the, free. You cannot be controlling them and asking them to work. That's not the leadership you are teaching. You are giving them free hand. Okay, this is what this project, this is what I expect, and please do it. She has done amazingly. My publication work, so many other things. So, Surekha, you have a fantastic leadership quality. Sheila, you as a chairperson, I'm very, very sure you will not just do the digital platform. You will come out something out of the box idea where you will keep your footprints in the ICOG. I'm sure. I'm eager to listen not only today's your vision of ICOG, but I'm looking forward on 13th to listen to your entire year program. There is always something to learn from everyone, and I'm taking over ISAR presidency. You never know. I may take some ideas from you as well. So thank you. Enjoy the podcast. You both will be in picture having dialogues, and I'm watching you and hearing you from the viewers link. So see you in Delhi, both of you. Have a great time together.
Thank you. Thank you very much, madam. Thank you
Thank
so
you.
much.
Thank you. Thank you, Sheila.
Thank you so much, Dr. Sunita.
Viewers, let me now introduce to you our guest for today, Dr. Sheila Mane. It is a privilege and honor to introduce a leader whose name has become synonymous with safe motherhood and postpartum hemorrhage prevention, fondly and respectfully known across the country and across the globe as the PPH lady. Dr. Sheila Mane is a distinguished academician, clinician, and mentor with an unwavering commitment to improving maternal outcomes. She holds the qualifications of MBBS, MD, FRCOG, FICOG, and FICMCH, reflecting both national and international recognition of her expertise. She is currently serving as the Vice Chairman of the Indian College of Obstetricians and Gynecologists and is the incoming chairperson of ICOG 2026. She is the Professor of Obstetrics and Gynecology at KC General Hospital, Government of Karnataka. Alongside her academic role, she continues active clinical practice as a consultant at Anugraha Nursing Home. Dr. Mane's enormous and sustained contributions to the field of PPH through training programs, workshops, protocols, capacity building initiatives has touched countless lives and empowered generations of healthcare providers. Her association as the faculty for FIGO PPH workshops has further strengthened her impact at both national and global levels. Her leadership and journey within Fogsi is equally remarkable. She has served as the Vice President of Fogsi 2014, Chairperson of the Safe Motherhood Committee 2008 to 11, and past President of Bangalore OBGY Society. She has also contributed academically as the Secretary of the Indian Menopause Society, Bangalore Chapter, National Corresponding Editor of Jogi as well. We admire you truly, madam, your credentials and accomplishment. And apart from that, you are a warm, compassionate human being, a mentor to many, believing in hand-holding and inspiring confidence. Ladies and gentlemen, please join me in welcoming a pioneer of safe motherhood, a passionate accommodation, and inspiring role model, Dr. Sheila Mane. Welcome, ma'am.
Thank you, Sunita, for those kind words.
Thank you.
And it's my proud privilege that today I have an opportunity to be there on your podcast, which has been structured by Dr. Sunita. And it's really a very happy feeling for me that you invited me before I take over as my ICOG chair in AICOG Delhi. And it's very nice that I got a platform to talk about this. And it's not only that I'm going to talk about it, but it will definitely give me more confidence and it will help me to take my spirit still high up, that now I have reached out to so many people and I will have to keep it up. And as Dr. Sunita said, that she's looking forward for my report on 13th and really looking forward to do something which is will be more valuable in future also. And let us look forward for definitely a fruitful year with all of you. Wishing you all a very happy new year to all the viewers today, and hoping to see you all in Delhi ICOG.
Madam, congratulations on being elected as the chairperson-elect of ICOG 2026. What does this role mean to you personally, and what kind of legacy do you hope to build?
Now, being in the chair in different positions as a vice chair and then the vice chair-elect and then the chair-elect and the chair, that gave me an opportunity to have a look at that how the ICOG is functioning. And the legacy continues, like the previous chairpersons have done a commendable work. And I just look at that when the COVID started, it was very difficult to reach out to people, but our senior madam, Dr. Mandakini Meg, she really created a platform and which has become a novelty now, and ICOG is grown so much now that it is very easy to reach to people, and the academics has really grown, Earlier also it is to happen, but the webinar, that virtual connection has given us a great opportunity. Now, I would like to build up a legacy where, we try to involve more and more people, because we have, if you look at NMC, we have so many medical colleges, we have so many teachers, we have faculties, and even the DNB institutes, the NB institutes. So, and all these people are involved in academics and but they are away from this. So by doing this, we will try to reach out to them to see to it that I would like to have to be maybe inclusive and involve more and more academicians and really try to search and hunt and see to it that who really has an interest, and the FICOG, those who have already taken FICOG, I would like to involve them in most of the program to see to it that they get involved in all the ICOG programs.
That's wonderful, madam. We are really eager for your tenure as ICOG chairperson, and we would really be like to be involved in your initiatives. We would like to know about your vision for the year and how do you see this vision evolving in today's rapidly changing OBGYN landscape?
Yeah. So my vision is, now we already have the academics, we have different courses. Now, if we look at the different courses, we will have to look at certain courses like the critical care in obstetrics, And as you said that I have worked as a Safe Motherhood Committee, and I also work with public sector in Karnataka, as well as I am associated with most of the other states also. Like I'm trying to get connected with states who have, there is a higher maternal mortality. So there is a need for such things which we will have to scale up in ICOG, through ICOG. We have to generate interest in people, that they have to come forward and to see to it that whosoever is working and whichever facility it is, at least they are able to handle the critically ill patient. See, all other courses are very popular, no doubt about it. People come forward for reproductive medicine, for fetal medicine, for endoscopy, all youngsters. But we have to create interest in this. So my vision is definitely again to strengthen the health facilities. And one more thing I would like to add is I'm also a member of FIGO committee of Health System Strengthening Committee. And Health System Strengthening Committee is my vision. And for that, I will have to see that what best we can see so that it will have an impact on overall women's health. It's not only the related to MCH, but the overall women's health, because we know that NCD is on the rise, the other issues are on the rise, which also we have to focus so that overall we look at a holistic approach towards the women's health. Now, all other aspects are always there. Like I would like to have some of the CMEs, which could be physical, which could be virtual also. And I call it as a holistic approach for 7H. Now, this 7H is, first comes HB, that is anemia. According to NFHS survey, still the anemia is not under control. We have to really look at it. Hypertension, hemorrhage, hyperglycemia, okay, HIV and STDs, because it has really raised its head again. If we listen to NACO and CAS people, we have to really focus on it again. And then comes high BMI. We know that high BMI and obesity is becoming our problem, and hormones. So all these 7H and a holistic approach in managing this, we will try to see how we spread the message through the academics. And I would like to be all inclusive, so that will help me to definitely change the OBGYN landscape, as far as I will try my best to do that.
Yes, ma'am. That is really wonderful to hear about your vision, the critical care aspect, inclusivity, and the 7H. Wonderful, I think. And we really have a lot of people to, in Foxy to guide. There have been several stalwarts in ICOG before you, leaders before you, and the guidance has been achieved from these stalwarts as well. So, what leadership values from past chairpersons and secretaries do you wish to carry forward? And how would you like to be different, inclusive, follow these people, and be different on your own as well? Please let us know.
I think, Surika, each person is different, because, when you look at the past chairpersons and their legacy and what they have, you learn from that. And that gives you ideas. Okay, yeah, I think we can do that. Definitely, the past chairpersons have worked very hard. And if we look at our fellowship programs, which are going so well and so popular, as I told you, and the way I must tell you, because I reach out to these people and I listen from them, that the classes are so nice. Even there is a request from other people that whether we can attend, but it is specifically made for the people, those who are registered with us for the fellowships. I think under Dr. Sunita's leadership, we are going to have a newer initiatives. Like we are looking forward to have our own ethical committee. Myself and Dr. Parag in conjunction, we are working on it. So if we have a ethical committee, as we know that the vision and mission of ICOG is, along with the academics, is research. And we have to really take it up very seriously. Because if you look at any multicentric studies or a meta-analysis, we don't find ourselves there. India is not there. We have to see to it that when we are looking at the meta-analysis, the systemic reviews, we find our country's name. And you are already into research, Surekha. We have to really brainstorm and see to it that ICOG name comes there. And Dr. Sunita is holding our hand. She wants us to collaborate with the Symbiosis International University. And this collaboration will take some time, and we know it step by step. Dr. Parag and Dr. Sunita have started, and I'm very fortunate to take it forward, and that will really help us to build ICOG academically, make it very, very strong, because we can have skill development. We can collaborate with medical colleges. We can have skill stations, because that is very important today. If we look at India, we have multiple medical colleges. We have so many postgraduates coming up. But what is important is a skill development. And I think, like ICOG should look forward in scaling up the skills in these youngsters who are going to do their post-graduation. Even when they come out, they should look at ICOG and say that I have a platform when I can really build up my skills and I can come forward.
Excellent, madam. I agree with you regarding the systematic reviews and meta-analysis. I myself I'm a part of the guideline development group at a national level. And I definitely agree with you that we have to come up with good studies and good data so that we are included as a country. We do have diverse, we have the population, we have the data, but we have to have a good kind of research so that we get included in these meta-analysis studies. Definitely, I agree with you, madam. Madam, I wanted to know, in the governing council of ICOG, there are around 30 members, and you have a really diverse governing council in 25-26. How do you want to balance continuity of your previous chairpersons with new innovations? How do you plan to use the expertise of these TCM members?
Yeah, you rightly said. I'm really blessed because I have a very academic, educative, as well as very senior professors, many of them. Many of them are into different fields like fetal medicine, then endoscopy, and I think all the aspects are covered there. Okay, so it's a very good opportunity for them, for me, to look at all that and involve them into all the activities. Like, yes, whatever certification courses, master class, Gurukul, Guru Mantra, and PG programs I have, they will be inclusive, but as well as our ICOG CME activities also, they will be included. Then we have sessions in the UA Foxes where I will get a chance, as well as, as I was talking about research, right? So I have to really see to it that how I involve all these people. And when you are talking about innovations, I think I am looking at AI. AI is the thing which is coming up, and I will have to see to it that how we can start doing something new with AI, because even wherever I go, I find so many conferences of the software people and all these people, the AI. In fact, when we were in Sampurna also, I found that there was something parallel going on. So now we have to really look at AI, that how we can incorporate into our practice, and which will help us to strengthen our systems more and more. And
Yes.
already some work is happening on that. But I think through ICOG also, I would like to take it forward.
Yeah, I remember in the Sampura conference at Pune, there was a session on artificial intelligence in research, the big data, how to use artificial intelligence and how we can, apply it in research as well. I think you can take up that also. So AI in clinical practice and AI in research. That's a really wonderful way of bringing up innovations in ICOG, and I truly commend you for that, madam. Madam, ICOG has number of structured certification courses and master classes spanning multiple subspecialties as well. We would like to know about these courses and would like to know what critical gaps in traditional postgraduate training are these programs trying to fill.
Yeah. See, now if I look at the certificate courses and the master classes, some of the certification courses I would like to really repeat. And in fact, I would like to reach with these certificate courses to each and every Foxy, particularly in B and C categories, where if they attend these courses, they get on-hand information, and it is very important for them, as well as the master classes. Now, master classes means we really have a faculty who are the expert in that field. Okay. And I'm looking forward for master classes like Jean Conray. I met the previous, our past FIGO president. She has done so much of work on environment. Okay. So looking forward for that. Then AI, I already mentioned to you. Then the other aspects like immunology. Okay. It is because we see the high risk pregnancy has gone up like anything. We see so many things happening. Apart from that, we have other subjects like we have ART, we have endoscopy, we have robotics. So definitely, it will be a novelty where the people will be, and master classes are very popular because they have to just log in for 3-4 hours and they can really listen. And I used to attend these master classes and you gain so much because you not only choose the national faculty, but international faculty also. So that will be a really very good thing if we try. Then the critical gaps in postgraduate training program, as such, when they are in medical colleges, I believe they have a regular curriculum. But I think I always look at these NBE students, the DNB, because those are run by some small private institutions and it is a very good opportunity for them. So I am going to collaborate with NBE, ICOG, NBE. And whatever postgraduate programs we are doing, I would like to see that the NBE students, the diploma, as well as the DNB students also join our program. Along with that, I would like to take a separate session on research methodology for the faculty of these medical college. People can always join, there is no doubt about that, but also the NBE teachers, because they are now in smaller hospitals, they may not get the exposure because they also have to guide the student, the selection of the topic, then the paper presentation, and the fellows, those who are working with us under ICOG fellowships, because we should motivate them to present something wherever they are working. So we will also involve them. So that is one additional thing. I think that is one gap which I would like to take forward. Otherwise, I think regularly Dr. Ashok Kumar, Dr. Hafizur, and Dr. Ashish Mukherjee also used to be involved. We used to have excellent case discussions and all that. And ODC program, which is started now, that medical education program, which we have started, will continue again, because that will again strengthen the medical teaching, and which will, because then it becomes, very friendly way of teaching the students. It's not like a regular class. We involve them only. We have the inner circle, then we have the outer circle, and we are asking them to work on it. And it becomes very interesting for the students also to learn.
Definitely, madam. The master classes, as you said, even I have attended number of master classes, because in a short span of time you get everything, and top-notch faculty, national and international is there. And definitely, as you said, the DNB students, the fellows, they definitely are going to benefit. And madam, even the PG clinics, we are having wonderful PG clinics focusing on OSCE, case presentation, hands-on skills. They're very, very popular among the postgraduates. What are these critical skills you want the PGs? How do you target these critical skills? And why do you believe that skill-based mentoring is the need of the hour?
Very, very rightly asked question. So for that, in fact, I would like to collaborate with the medical colleges. Okay, because medical colleges, we can conduct this, and then we can do this skill development program. which is very important. And that way we can do it virtually also, we can do it physically also, where we can involve the, because if you take one city, one big city, you may lose the count. You have so many medical colleges, and it's a good opportunity to getting so many people under one umbrella when you want to do the skill development. Now, we also have endoscopy skill development, like Dr. Parul Kotadwala is into it, and we will continue to do that. And we'll be also involving the other associations who can help us, who are the expert in that and they are focused in that, to take this skill forward for all the youngsters.
Yeah, that is lovely, madam. And also regarding our Guru Mantra. So these initiatives like Guru Mantra, journal clubs, which are conducted with Jogi as well as international organization like with CEFOG, they are very unique. We would like, our audience would like to know elaborately about these initiatives, and how do these platforms bridge the gap between experience, evidence, and ethics. We'd like to know from you, ma'am.
Yeah. See, now there are so many things in our practice where we have so much of ethical dilemma. Okay. And this ethical dilemma will always is wavery, and people don't know how to take decisions. So I would like to have the program, and we recently had, I think, one program I have attended with Dr. Sanjay Gupte, and it was excellent. Few were discussed, but we would like to have this teaching also about the ethical dilemmas, and FIGO has given a nice guidelines for this anyway. So we can have that also, as well as as you were asking me about one more
Guru
thing.
Mantra.
Guru Mantra. See, now Guru Mantra is, we have so many seniors in our country, and as you said, experience and the knowledge. Okay. And listening to them itself is, if you go to any conference, you will be running to listen to somebody, right? This person is going to talk, let me pick up some points, and there are take-home messages are there. Now, if we bring them on Guru Mantra platform, they will have a time to talk almost 30 to 45 minutes, sharing their experience, and our members, the Foxian, can really listen to them, and they can really learn from it. Not only it is about the subject, but how they have reached this stage, how they have built up this, how they have done the innovations, which will definitely help the younger generation to look at them and see that how one can build up and strengthen the society. At the end of the day, whatever we learn, we apply it to the society, and our aim is to see that we have at the end of the day, a healthy population. So that should
Definitely, ma'am. And also, madam, I have attended a lot of the Jogi, the research clubs, the journal clubs. They also presented very well. The format is so good. So we'd like to know about that too. How those are selected.
See, journal club, again, even we were thinking of doing it in collaboration with other federations also. Like Dr. Shyam Desai has requested with CEFOG. Then we can also look forward for AOFOG also, where we can spread the word about ICOG also, that how we are conducting this. And, by conducting the journal club, you come to know about a research, because how the people are working, what are the innovative ideas they are getting. We have so much of clinical material, okay, but we don't know how to take it forward, how to do the studies, how to do the research. So when you listen or attend this journal club, yes, postgraduates are presenting, but when they go for the exams, they also have some marks for that. No, what are the newer concepts? So they have to know all those things, and this journal club will help them to know that how the studies are conducted, how they are presented, and what are
As
the
a clinical,
drawbacks there
yes,
are.
ma'am.
Yeah.
So as a clinical research committee chairperson, I have also collaborated with number of organizations, like we have done with TNFOG, we have done with KFOG, we have done with Karnataka Society,
Yes, yes.
EMOG. So this was really wonderful, because postgraduates and faculty from various medical colleges, they also have their inputs in, and they get involved in these academic initiatives. So really wonderful. I think this ICOG's Journal Club is really wonderful. And as you said, if we collaborate with international organizations, then we have a wider vision as well. So
And just
congratulations on, yes,
about
ma'am.
the state, every state has an organization. We can involve, they do it beautifully, Even I go as an expert there. Yeah.
I read about your very innovative ICOG Academic Steering Committee. I think that is a very, very wonderful initiative, and it is going to create a lot of ripples in strengthening the clinical research. As you have rightly said, you are focusing on research, you are focusing on evidence. So, how do you plan to implement this endeavor? Do you envision that ICOG is going to emerge as a major research-driven academic body in the future?
Yeah. See, it is constituted to streamline, to standardize, and to strengthen all activities of ICOG. Okay. And the certificate courses, and we also have to ensure seamless coordination with relevant Fogsi committees. So we have to work together because we are under one umbrella. And we will have an advisory group, which will be with the senior members. Then we will have a working group where we will have a core implementation group who will be given some task and they will be doing that. Then course specific subgroups, because we have different courses. So we should have course specific subgroups, as well as we will have to collaborate with all the office bearers of ICOG, the chairpersons and vice chairperson, as well as the secretary. And they can definitely help me in making the annual academic planning, ensure governance, transparency, and timely implementation, which will help, if we add this. And definitely we have to coordinate with Foxy leadership, and we have to have a periodic review meetings and policy updates if we are going to have. And we have the administrative secretariat definitely there. So we will collaborate with them because we need logistics for exams, for meetings, for communication. Then we have to maintain records, documentation, and provide operational assistance to the course directors as well as the examiners, because we have so many examiners coming. And then definitely we need strategic planning, course oversight. We will have to look at the prospectus. The quality assurance is very important when we are making these courses, that what is that, and monitoring and reporting. Innovation and expansion. We should have innovation. And I must tell you that there are so many people who are innovating so many things, and they don't know to whom to tell and where to tell. So let us spread the message that we also have a committee, advisory committee, academic, where everybody can come and approach about their innovations. And if they have any ideas, they can collaborate with us and to see to it that if we can find a way to take it forward, we can definitely take those innovative ideas. Okay. So we have advisory group, we have working group, we have course directors, we have examiners, and coordinators with Foxy teams.
Madam, it seems as if whole of the thing is like working of a university. I have been on the board of a number of universities like MUHS and Pravah University and DMIHR. And what you have just described looks like, a working of a university. And I've definitely, I think the college, the Indian college is going to go set a very, very high benchmark as far as academic is concerned. And this steering committee, as you have described, is really going to take ICOG way, way forward in the future. I must congratulate you for this very, very thoughtful innovation of the steering committee. And we look forward for the implementation of the, this committee and the vision they will be taking forward. Madam, in your tenure, you are also collaborating with the public health sector. You have done these collaborations in the past as well, and now as a ICOG chair, the ICOG will collaborate with the public health sector. So please let us know about these collaborations and how you're going to implement them.
See, I think, Rao, the current issue with us, we know that we have a SDG goal of achieving maternal mortality less than 70. Now we know that Maharashtra and South and few of the states have already achieved, but there are so many states which have not achieved this, So I think reaching the unreached is our goal. If we look at the causes, all of us, we know, as I said, that 7H, that we have hemorrhage, we have hypertension and all this. So I would like to collaborate with the Family Welfare Department as well as the NHM of that particular state. We have state bodies. Every state has their own association. Through them, if we can collaborate with them, and we try to see that it is very difficult to do it physically, but virtually if we can collect, and we have so many societies, we have chairpersons, we have talented office bearers, and I have a governing council, the past as well as the present, and they all are very eager to work. So we can collaborate even with the state bodies and then see to it that the topics related to maternal and child health, at least if we are able to do it through the certification courses for them, for the government and the public sector, I think we will be able to do uh, good to the society.
Definitely, madam. As you rightly know, in the past we have, collaborated with UNICEF, with other bodies, with MOHFW for optimizing C-section. We have done. Dr. Sunita has done for preconceptional care. For
Yes.
HPV Save project, we have done. So there is, such a lot of things to do in collaboration. And definitely, I think with your past experience with public health sector, we will see a unique collaboration of ICOG as the academic wing with public health sector. And
And Dr.
definitely it is, yeah, ma'am.
Parag was really helpful when I did it for Karnataka. And I don't know what you call it in Marathi, Mamata card or Ma card, I card. We say is a Thai card in Karnataka. And we have included justosis score in the Thai card. And every medical officer in every PSC knows what is justosis, because we don't have the investigation facilities, like we can't do the NT scan and assess all those, but at least the history, from the medical history we assess, and it is already been rolled out, and we are giving them ecosprin once we realize that they are the high risk for developing hypertension in as they go ahead with the pregnancy. So I wish to see that we also collaborate with other states, and trying to get in touch with other states like Assam, Madhya Pradesh, as well as Rajasthan, and slowly
It is
we will.
lovely, madam. I think justosis with under the vision of Dr. Sanjay Gupte, then we have Dr. Girja Wagh and the justosis core. Lovely that our public health sector is we have the cards describing the justosis score and getting implemented. So that's really wonderful, and big congratulations to a ma'am for that.
Dr.
Madam,
Sanjay Gupta himself was there. He attended that, and he is very much aware of it. Yeah. Yes.
yeah, thank you, ma'am. Madam, about these ICOG books you have planned, from nutrition to placenta to fertility and ethics, so many things you're covering. Madam, these ICOG publication, how do they impact everyday clinical decision making? And another thing is, how can Foxians contribute to these publications as well and feel included? Both the things I would like.
See, now publications is definitely many people come up with publications. So now when we are focusing on ICOG campus, as such, we don't want to come out with a very big book or anything, but simple things in the ICOG campus, where if we take one point, suppose if you take a placenta, it's such an important thing, placenta. So we can cover so many aspects. Now, as you are asking me how you can involve the Foxians, I mean, nutrition is always there now, and so many like ovarian aging and all those, so many other topics are our mind. And NCD is the another thing which is there on my mind, because it is again related to women's health. So I would like to involve the people, those who are already FICOG, would like to get in touch with everybody and would like to know from them that whether they would like to get involved into this, and we will try to be inclusive, and we are going to release it in your Foxes as well as the national conference of ICOG, which is happening in Bangalore on 22nd and 23rd of August. And I take this opportunity to invite all of you, as well as in VP conference and Dr. Bhaskar Pal's president conference in Calcutta.
That is lovely to know, ma'am. So I think all the Foxians or attending AICOG would be eager to know all these publications and your presentations. We will definitely come physically and attend your presentation so that all of us know where we can contribute and how these publications will help us do better in our clinical practice. So all the Foxians I invite, definitely attend Madam's installation as the chairperson of ICOG at AICOG 2026 at New Delhi. Madam, I would like to know from you about the Foxy, the ICOG Youth Cell. I'm really keen to know under the leadership. I think the Youth Cell is being led by Dr. Sujitra Pandit under your leadership. How would this focus on leadership, communication, mental health, and financial planning? I think that's wonderful. How do you want to implement this initiative, and why do you think these competencies are essential for today and tomorrow's OBGYN? So please let us know about the
Yeah.
youth cell.
I think we just had one program that is like a pilot, which Dr. Suchitra did with ICOG recently with Dr. Parag on 19th of December. Okay, so it is her idea, and I must appreciate Dr. Suchitra started with adolescent and youth melas, and now she wants to involve, which is a really excellent idea. So we would like to involve, because the young people think differently. They think differently, and there are many, we can find many leaders in that. The communication skills are very important there. And as you said, mental health, not only for the patients, but even for us and for everybody, it is very important. Financial planning as well. I think the younger generation is more smarter than us. But if we try to involve it also in our planning and we try to reach out to them, and I feel if we involve young people, they have more ideas, because I think their approach is different than us. Maybe we read more, but they have so much of broad, I must say, the platform where they can reach out to many things in such a short time. Okay. So would like to involve more and more young people so that they also come to know about ICOG. And in future, definitely they'll be becoming, definitely with their credentials, they will take FICOG. And it is always, you are a teacher, I am a teacher, Surekha, when you are amongst young people, you feel you are young. You remain young, because the young minds are with you. That energy, which gives you so much of positive energy, you go and take one class the way, and then you interact with them. And it's very nice to communicate with them, and we should see to it. And communication has become a very important part of undergraduate teaching now. No, there is, because you are in medical college. So that should continue here also. I think it's very important.
Yes, definitely. And as you rightly said, being a teacher, we are always with young people, undergraduates, interns, PGs, and definitely I think we brush ourselves up with new things. Even at our age, we know about AI, how to use it in clinical practice, how to use it in research, and we are eager to learn everything. That is because we are in touch with the youngsters. And I really appreciate Dr. Suchitra Pandit's this endeavor about communication skills and, even that finances, that's so important. So I think it's wonderful to hear from you about ICOG's vision, your enthusiasm. It is so good to listen to you about what you're going to do, starting from academics, research, collaborations, public health, your 7H mantra. It is really exciting, madam. And I think we have done almost 40 minutes of podcast with you. And I thought you just started or something, but really we have learned a lot from you about this vision. And the last question, I think we are there now. We'd like to know, as you step into this leadership role, what is your message to young OBGYNs and teachers who wish to actively contribute to ICOG's academic journey?
As I said, that we should involve more and more with medical colleges and NBA. And I think, as it will be more inclusive, already the teaching programs, we are reaching out to medical colleges and most of the faculties who are not known to many, but we are involving them and they're getting an opportunity. Youngsters, youngsters means postgraduates, yes, they're busy with their thesis, with their studies, and they focus on exams, so fine. But after that, They have their vision, their own vision, that what they want to do. I think ICOG, as I said, no, skill development. And now if we are going to collaborate with universities, we will have a more broader platform where we can accommodate more and more people. We can involve them also. We can have TOTs. We can have training of the trainers. No, like you have discussed with me some of the programs, some research projects where you said that even undergraduate also are equally important when we are talking about the maternal and child health. So I think we should sensitize them at that from that stage only, that how important it is. Okay. And the another thing which we have to tell them, that the day we finish our post graduation, yes, we are not consultants. We have to really learn a lot. So the skill development is very important, and I think ICOG is spreading its wings to see to it that we are able to do that. So all the youngsters should look forward in participating all the activities of ICOG as well as Fogsi, because Fogsi also we have a PG teaching program which happens physically. So that will also help them. And many youngsters should come forward. And as Dr. Suchitra wants that every program, let us start involving at least 2 young people, and by involving them, we will already give them the projection. If they come forward, they will tell others, and like that it will be all inclusive. And I must say that Guru Mantra is the program which was started by Dr. Lakshmi Shrikhande, and I would like to really continue that. Dr. Uday Thanawala, he spoke about our all the teachers, the great teachers, innovators, India's innovators. Again, highlighting them, and like that now there are many innovations which are happening over a period of time. So if we look at the earlier chairpersons as well as secretaries also, they have done a great work, I would like to thank seniors like Dr. Hema Divakar and Dr. Atul Munshi also, because during their time we had this academic council and all those things, and I took inputs from them. And many people, even Dr. Dilip Datta, who works so tirelessly, and I have seen him doing so many things at FIGO. Okay, Dr. Hiralal Kunar, who is such a great academician, and many more, and Dr. Durusha, who is a real visionary, and really, really learned a lot from her.
Yes, ma'am. Dr. Uday Thanawalas, as you rightly said, they are on YouTube. I have listened to those really very well curated, beautiful they have come. Dr. Lakshmi Shrikhande, as you rightly said, has done a wonderful job. Dr. Hira Lal Konar, so many times he comes as a judge, or you call him anytime. They are so humble also. And definitely all the past chairpersons, the past chairpersons of ICOG, they are really great, great, great stalwarts. And Dr. Mandakini Meg, Dr. Parul Kothadawala, lovely people and great academicians. And you, madam, we are now very, very eager to have you as the Dr. Parag Biniwale, such a humble person, but such a lot of work he has done during his tenure in 2025. So congratulations to all the chairpersons of ICOG and to you. We are very, very eager to have you as the ICOG chairperson in 2026, and will be there at your installation at Delhi.
Yeah, one thing I would like to really thank Dr. Parag, because when I am stepping into this post, I really need his guidance, because he's been there for 1 year and so many new things are coming up. As I said, the ethical committee, and Parag is really working hard on that. And we would like to come up with a tagline for ICOG, which is again a initiative from Dr. Parag and Dr. Sarita Bhalera, as well as Dr. Parul, setting the benchmark for OBGYN excellence is our tagline.
Lovely. Setting the benchmark with you and Dr. Pratik Tambe also getting installed as the secretary. I think it is going to be a great combination.
I'm very happy that I have a very, very competent secretary with me, that is Dr. Pratik Tambe. Dr. Sadhna Gupta, all of us, we know, so active she is, Every day I see somewhere she is conducting some webinar. And Dr. Ashok Kumar is there, who is taking care of postgraduate program. And all of us have seen Dr. Sarita for 2 years, working so hard, such a simple, humble person who is going to be there as a vice chair elect, and she'll be also inclusive, and all of us together working.
Yes, madam. We are coming to the close of this enlightening episode of Gyan Pravaha. I extend my heartfelt gratitude to Dr. Sheila Mane for sharing her remarkable journey and deep insights into the ICOG Vision 2026. A special thanks to Dr. Sunita Tandulwadkar, the president of Fogsi 2025, whose visionary leadership continues to inspire and empower meaningful dialogues. And to our listeners, thank you for joining us today. Your
Thanks.
curiosity and commitment to advancing healthcare keeps this conversation alive and purposeful. Stay tuned for more thought-provoking episodes of Gyan Pravaha. I, Dr. Surekha Taire, with Dr. Sheila Mane, signing off. Until next time, keep listening, keep learning, keep your hearts open.
So as I said with Foxy, I would like to thank Dr. Bhaskar Pal for giving me nice insights and guiding me, because whatever ICOG is doing under his presidency. And I always take his advice, and now the more and more research, which whatever we want to do, we will be doing it in collaboration, as well as Dr. Suvarna Khadilkar, who is always there as a Secretary General of Foxy to help us and to guide us and to know the nitty-gritties of Foxy and ICOG. We always look forward to Dr. Suvarna. Thank you, Dr. Bhaskar.
Yes, definitely. Dr. Bhaskar Pal as the incoming president of Foxy 2026.
And ICOG.
And as well as the ICOG, leader as well, guiding force, and Dr. Suvarna Khadilkar. Thank you very much, listeners, for being with us. Thank you. I, Dr. Surekha Taire, and Dr. Sheila Mane, signing off. A very good evening to you all.